In the fall of 2014, at the age of 34, I found a lump under my arm when I was nursing our 18-month-old daughter. I was diagnosed with stage 2B triple positive breast cancer. I went to a large cancer center and did chemo, surgery, and radiation. At the time of surgery, 7 of 8 lymph nodes were still positive for breast cancer. This changed my pathological staging to stage 3A, and I knew I was high risk for recurrence. Just 6 months after finishing treatment, I found lymph nodes in my neck on the opposite side of my body. The breast cancer had metastasized to stage 4. I chose to go to an oncologist who has his own practice and does things a little bit outside of the box. I started chemotherapy again and got back into remission. Then, in the spring of 2017, another lymph node popped up on my neck. At this time, I did targeted radiation and we changed up my chemo regimen. I stayed in remission until spring of 2020, when a single bone lesion popped up on my hip. I did targeted radiation once again, and again we changed up my chemo regimen. I've now been in remission since June of 2020. I've been doing active treatment for 9 years and have been living with metastatic breast cancer for 7 years. The treatment and its side effects have its own challenges, but what I found to be even more difficult is the mental and emotional toll that cancer can take. Some of the things that have been helpful for me are going to therapy, taking a low-dose anti-anxiety medication, voicing my feelings, learning to accept help, hydrating my body, feeding it well, and moving my body, getting good sleep. I try not to have hard conversations or think about hard things after 7 p.m. because I know my capacity to handle the hard is much greater after a good night of sleep. Now, I've also learned to give myself grace because I can't do all of these things all of the time. So learning to give myself grace and do what I can each day has been super helpful.